Welcome to Shweta's Talkies Season 1. Let's chat and have some fun.
People, their lives, their struggles and their joys. Faces, their truths and their beauty. Things of value, not price. I'm old school and I'm blunt. I like to explore things. I like to explore people and their emotions, places and their truths. Join me for Shweta's Talkies. Hi guys, today we have Dr. Aamod Rao all the way from Bombay sitting in my studios. I'm very excited. Welcome.
Thank you.
Welcome. You've done over 1,000 cosmetic surgeries over a period of more than a decade by now.
That's right.
You've seen things that most men don't.
Yeah, that's true.
How has it been for you so far?
Oh, it's been good. It's been challenging. It's been stressful at times. And it's also very satisfying at times also, most of the time.
And there is a lot of controversy around plastic surgery,
Yes.
cosmetic surgery, right?
Right.
But there are all kinds. There are ones to make you look nicer. Then there are other ones to correct some issues which make a person
That's
feel
true.
better about it. What is the large difference? I mean, you must be getting two kind of clients. from every
So,
side.
plastic surgery itself is a very vast field. It comprises of craniofacial, burns, congenital anomalies, pediatric plastic. Cosmetic is part of the field. Hand surgeries, reconstructive, cancer reconstructions. So, all comes under plastic surgery. It's a huge umbrella. And all of it is to fix a defect.
Fix a defect.
Whether it is congenital or whether it is post-traumatic or whether it is for cosmetic reasons. So we are all fixing a defect. We're fixing stuff. Plastic surgeons are called fixers. A cancer surgeon would remove a tumor and a plastic surgeon would fix the guy up. Because once, suppose a face tumor is removed, then the entire cheek will be exposed.
I want to know about a fun story with a patient who was actually one of the best patients because it was a repeat patient. Repeat clientele,
Yeah,
I
so
must say.
I did a facelift for her and there were some threads inside her face,
Okay.
which I pulled out.
So facelift is the whole
Yeah,
thing.
where you want to look younger and you go inside and you pull the muscle up. So when I went to do that, she had apparently gone and done threads a few months back or a year back, and I found those threads and I pulled it. On one side, the nerve got damaged, the facial nerve, and then she had a facial nerve palsy after the surgery. So she
What?
was crooked when she started.
Oh, no.
Yeah. So that was sorted. I took care of it. I had another colleague of mine who specializes in this to help out. She was grateful enough to help out, and this patient was patient enough.
It's a star patient. I'd have a freak
It's a
attack.
star patient.
It's a star patient.
And the patient also was a star patient.
Oh, it was a truly star patient.
true,
Oh, we
yeah.
can't ask you that now, can
Yeah, I
we?
can't give you the name, but
I
yes. So she was a real sweetheart. Finally, she did manage to, we have healed her totally, and I think she's fine now.
You've been doing it for over a decade now. How has the science changed?
So the technology,
For let's say basic, just like
the
for the dummies.
procedures, the equipment, like now we have a laser or ultrasound assisted liposuction, where we use special cannulas which will only, the frequency it emits only ruptures the fat cells, causing minimal damage to other structures. So the amount of fat we take out is better, causes the skin to contract after we do a liposuction. That's called laser assisted, ultrasound assisted liposuction.
Oh, I
So
see.
there are different, like there is an endoscopic brow lift which you can just do with a small incision in the scalp. There are newer techniques coming in.
Has it become relatively safer? Would you say
So
that?
yes, see, any surgery, the patient has to be fit. If you do a surgery on an unfit patient, the risk increases. If you do
Nice.
a surgery which is not indicated for a patient having
Not
some
indicated
complication.
means?
Now suppose the patient says she wants a nose job, and you actually don't feel that she needs a nose job. Then she might not be really happy after you do a procedure for her.
Is it a dilemma where you actually think the person is actually perfect, but they still want to make due corrections?
Yes.
Your advice would be
Not to do it.
not to do it.
Yes. And I don't know.
And how
usually.
often does that advice work?
Number of times. I mean,
Oh, it
quite a
does.
bit.
Quite a
a
bit.
bit. Yes.
So people
More
are
than
receptive to-
50%. They do accept it.
This is great. Now you're actually letting go of your billing
Yes.
just to do the right thing.
Yeah, because see, if I do a surgery for the patient who doesn't really require it, it's going to backfire on me finally. No, I don't want to do that. It's not fair, and I don't practice like that. If a person doesn't need it, I just tell them, look, you don't need it. Or you could do another procedure which is not so invasive. Like suppose even for the correction of the nose, you can put in fillers. Or you have under eye bags in the initial stages, you can correct it with fillers. You don't need to undergo the knife. So I tell them to do that. And then I give them the alternatives, or tell them just don't do it or wait for some more time.
And has any of your attempts failed?
Of doing the surgery?
No,
Yes.
of telling them not to, but they.
Oh yeah, there are some people. So then they keep coming back to me, and then I know that they really want something, and then I do it for them.
Oh, I see.
Yes, it has to be indicated. I mean, if they come and they tell me like, you know what, make my breast like huge and stuff, I don't do all this. I tell them to go to someone else.
What's the bizarrest request you've had so far? We don't need names, but I'm
Yeah,
dying to know.
I had this guy who came to me. He was from the Northeast, and he wanted a hole in his cheek. So he wanted a ring to a hole.
Sorry, what? Okay,
Yeah,
okay.
I have no. He showed me some picture of some sort of body piercing, but it was entire hole in the cheek. You could see his mouth inside. The picture, he said, "Please do this for me." I was like, hello.
Oh my God.
I have never seen this, and I'm not going to do it.
It's a bit of a rage. In US, there's a lot of, what are these called? Body modification surgeries that they've started doing. Some kind of a fad or whatever. I mean, no judging. But
so they keep naming, or they keep giving it more fancier names every time to just increase the footfall. And they'll come up with a new fad, or this is the body modifying procedure or something like that, with a slight here and there changes. But that's it.
the guy wanted a hole in his mouth. What are the other ones? Now you've got
Hole, no hood.
Literally
one
hole.
Well, yeah, he wanted inside a big ring like this. I said, look, I've not done it, and I wouldn't even do it if I knew how to.
And maybe the other example?
Well, I had this lady who wanted humongous breasts, and she was so thin. And she wanted a 600cc implant because her friend had a 500cc implant.
Can you tell me in size?
I mean,
sorry.
So they are dome shape. You get different shapes. You get circular, you get teardrop, then you get the height depending upon, and the width depending upon the volume you are wanting to put inside.
I see.
And
600cc would be?
It's huge. It's like this big. It's huge. And it's heavy. So 600 ml, just imagine, like a Coke bottle, the half small Coke bottle, slightly more than that. That much of fluid inside you on each side. So an entire Coke bottle in your body. Can you believe that?
But that
and she was so thin. The thing was, she was petite.
It puts weight on the back.
I have to have enough elasticity for it to fit in.
I see. Oh,
I can't just push it in. So, I mean, I didn't do it, so I sent her off. I don't know whether she did it somewhere else or not.
You've been practicing independently for a while. You have your own practice in Bombay.
I practice in Bombay. I go to Bangalore to operate.
You went to Uganda, I heard.
Yes, I started a clinic in Uganda.
Oh,
in Kampala.
Congratulations.
Thank you. In Kampala, independent. I did the first facelift surgery of that country.
And you do quite a bit of work in Delhi as well?
Yes, on and off. I have a friend over here who I do come and help out, or because we share a very good relationship. So.
And is there like a significant difference between Delhi clients and Bombay clients?
Not
kind
really.
of, sort
Slightly,
of. Everybody wants to look hot.
Yes, everybody wants to look great. Or greater.
Or greater. Over a decade of surgeries later, tell us about one of the toughest cases you've dealt with.
There were many cases which were tough, and I managed to do it. But it's like this, I always prepare for my surgeries the day before, or the early mornings. I go through papers, I go and see videos, and if I need an update of something which I'm doing new. But the worst I've done is for a lady who I did a revision rhinoplasty, a nose job, which I shouldn't have done. And it was an error of judgment from my side. And it got really screwed up. And she had a lot of adhesions, and she was a smoker, but she forced me into doing it also, and she was really persistent, and I gave in. And I did the procedure, and it ended up with a very bad nose, and then she had it was slightly deformed. She went berserk.
Oh no.
Oh yeah, of course. I mean,
yeah.
I did, and I went and told her, look, it was a problem, it was difficult, and I haven't done much. I had to close you because you had a lot of adhesions. Well, I had to sort it out, and then we had to wait for a year. I did some microfat grafts, and then I got a good colleague friend of mine who was an excellent rhinoplasty surgeon from Pune to get the surgery done. Finally, he did it. We actually wanted to get a German surgeon who was visiting to do it, but he refused to do it. This lady was an Israeli lady. I mean, he refused to do it. And then this friend of mine, I got to know him because of this patient, and he was kind enough to fix her nose. And so now it's all sorted. Now she's good.
And
that was the worst one I've had to date.
And this whole drama lasted?
2 years.
Oh my God, really?
Rhinoplasty surgery, once you do once, you should not do it. You should not try and repeat the surgery for at least 8 months to a year, which I did in 8 months or 6 months or so. Now, little did I know that she smokes a lot, and apparently she snuffs some stuff. And anyways, I shouldn't have done it. Basically, it was my call.
Fair enough. What was your first surgery like? First ever?
Well, I prepared, I think, for the first surgery for 2 days. I was like totally stressed out.
You prepared for it for 2 days?
Yeah, because I just kept reading stuff and going through videos and speaking to my senior colleagues. It was a tummy tuck surgery which I did.
At that, like the
Yeah.
big one.
Yeah, a big one. So, well, it did go well. It took me about 4.5 hours to do it. I usually finish a tuck now in about 2.5 hours. So I took double
so
the time.
for that time you did it in 4 hours, and now you can do it in.
2.5 hours usually.
What was going through your mind?
So I had written down notes and I had made pointers like first do this, second do this, third do this,
Tell
and
me
I had a checklist.
What does it say exactly?
So like first the anesthesia, then painting and draping.
Painting and draping.
Yeah, meaning we put antiseptic solution
Oh, I
to have the field as sterile as possible. And then where to put the incision, you draw the markings. You need to do markings before you operate. In plastic surgery, everything has to be marked first. And a standing position, sitting position, in lying position, and all those sort of things. I did all that, had a checklist, and then followed the checklists and put the checklist on the wall. So I kept, telling the ward boy, "Wo tick karo, wo tick karo."
Achha.
And that's how I finished the first surgery.
Was it a man or a woman?
Woman,
It was
a girl,
woman.
a lady.
It was a girl. And that went off well?
It went up very well. The result came out well.
She made a swan out of
Patients
her?
very happy. Yeah.
You made a swan out of her?
Yeah.
How many swans do you make a day?
No, I usually don't operate more than two surgeries a day if I have, but I usually it's one surgery a day because you get tired for a long surgery, and usually nowadays I do breast and tummy together. That takes me about 6 hours to do.
Oh, I see.
So after that, I don't operate anymore because then I'm exhausted. Then it's not fair that I sit and I operate on another person in a state of exhaustion. It's not good for me and not good for the result.
Oh, interesting. And one thing I did realize that it's not always, let's say if you want to fix a place of your body, it sometimes also takes general anesthesia. So it's actually like a full-blown
It's a full-blown surgery. Yes,
surgery.
it's a proper surgery.
People tend to take, some are comfortable with it, some of them make light of it, but it's a full-blown surgery.
It's a full-blown surgery. So let them do what they feel, but I need to see that a patient is fit before I do a surgery. So if there's a proper thorough preoperative checkup, a physician sees the patient, clears him, the anesthetist sees the patient, clears the patient, and then we operate. I don't just take somebody and come on the table and I just don't operate.
And I've heard, and this is coming from my family is mildly diabetic. That's a different story, does it? When people with sugar...
Yeah, diabetics heal slower. Chances of infection and complications are way higher in diabetics than smokers. They heal slower, always, and they end up with some sort of infection or something. So we have to
Diabetics and smokers.
Smokers heal much slower. The scar tissue form, the healing tissue is much more poorer than in a non-smoker. Diabetics also don't heal very well. So if the sugars are not controlled, I don't touch them.
Oh, I see. So you actually brief them to control the sugar before?
Yes. So I have to get their glycosylated hemoglobin levels done, the sugar level done, and see that they're fit. If it's not under control, I don't do it. I postpone the surgery.
While I was speaking to you earlier, you do advise actual weight loss for a lot of people before they want to just come in for a wax. Tell us a little
plastic
bit.
surgery or cosmetic surgery is not a weight loss or weight losing procedure. It is more of a body shaping procedure. The best way to lose weight is diet and exercise, a healthy lifestyle. There's nothing to replace that. But yes, certain things like after pregnancy, when a lady has loose skin and stretch marks, whatever amount of exercise she does is not going to contract. That's when you come to us and get a tummy tuck done, or you get a breast lift done, because it's not going to go back to pre-pregnancy state. And there are many instances when we operate, we give them a much better result than what they would have had before pregnancy.
Oh, that's
So
possible,
we can
is
start
it?
everything. Yeah, we can make six-pack abs, we can give the center line, we can make all the curves.
Mommy makeover.
Mummy makeovers.
I read that on your
Resume.
Yes. What is mommy makeovers?
So it's basically surgeries which are done for ladies after pregnancy, because the body undergoes a lot of changes. Either the breast sags or the breast shrink, and the tummy sags, the private part, they loosen if they've had a they have a normal delivery. So all that can be corrected. So the breast can be lifted, they can be tightened, the tummy can be flattened, the vagina can be tightened.
What does the daddy makeovers look like?
There are no daddy makeovers, unfortunately, except the six-pack abs that they want now. They don't undergo any changes.
They don't undergo any.
The
so
men don't
unfair,
suffer.
though.
Yeah,
It's so unfair,
It
though.
is. I agree, it is unfair.
So I'm going to ask you a little embarrassing question. Okay. You see a lot of naked women. Is the mental decorum tough or easy?
Well, I have managed to sort of
I'm already laughing.
have two eyes, two sets of mind. So when I'm examining a patient, it's a patient. It's like an artist working on a sculpture. There is no sexual thoughts in my mind. And I always examine a female patient with another chaperone, like a nurse who's with me. She's there, that's for my safety than anything else.
Wow, why? They beat you up?
No, I mean,
joking.
anyone can, yeah, but there can always be allegations. Also makes the patient more comfortable when there is another female in the room.
You must be a hero with your friends.
Oh yeah, all of them want to be my assistant.
No. That's actually, of course they do.
And they've all applied for the job, but none of them have got it as yet.
They got
No, yeah.
You've worked with enough stars.
Yeah.
I would assume, being in Bombay, you've worked with
I
pretty
have
much
a few, yes.
all of them. And this is basically, they themselves are their own assets. So this is assuming asset maintenance for them.
True.
Right? In a way.
It's a very competitive field, so they always need to look perfect.
They need to look perfect.
Yes.
Any stars, you can't tell the names, can you?
No,
Any
no names.
Good
but
stories you can tell us about.
yeah, so they have a couple who keep coming back to me for minor corrections, and I just don't do it because it's really not required. It takes a long time to convince them. And one thing about operating the stars is they want to heal faster than the normal people. Or they say, oh, I've got a shoot, I need to heal properly. It doesn't work like that. You tell your body that you have a shoot and you should heal. The star's body and a normal person, I mean, a non-actor or a non-celeb body is going to heal the same way. Or in fact, sometimes they are so malnourished because they do not eat properly that they have a lot of deficiencies, and then they end up healing slower.
Do you have like frequent?
Oh yes, I have a few who come, stars who keep coming to me to get the minor corrections as they age. Sometimes I do it, sometimes, most of the times I don't. I tell them not to do it, and they are quite convinced with whatever I tell them.
Of course, because
then they know that, and then they go back, yes.
Going back is a commentary on your efficacy. I think that would happen.
Yes, I mean, I give them a comfort level when I talk to them and examine them, and that's what they tell me, that we are initially very anxious when we come and see you, but then after we interact with you, they say they get a comfort level and they're quiet.
Your practice back in Bombay with 3 separate outfits.
So I operate depending upon the budget of the patient and what they want. So there are different hospitals I operate at. I have a clinic, my consulting room at a certain place. It's called Tuti Polyclinic, and I have my own room set up there. And I operate at Shetty Nursing Home, which is just below my clinic, and at Khar Hinduja and Women's Hospital in Bombay. I also do go to Goa at times. There's only one clinic which arranges for patients.
So you're operating in Delhi, Goa, Bangalore. And
Delhi, not so frequent. I do come here sometimes. Yes.
This industry per se, it's not the oldest industry. I think it's more dependent
on the newer
on
industry
science.
Compared to the Western countries. Yes, because I mean the Western women or Western people are more open to the surgeries they do. They would come and tell, and then so all these cosmetic surgeries did originate there. There is the foremost country in cosmetic surgery is Brazil. So we had this great plastic surgeon called Ivo Pitangi, and he had popularized cosmetic surgery in South America and the rest of the world with his surgeries and writing books. And so many of the surgeries are named after him. There are certain ligaments in the nose itself also is called the Pitangi ligament. It's all named after him. So he's given the names, he's found it out, he's got the anatomy. He was a brilliant surgeon.
How's India doing on a more global level?
Oh, we have picked up a lot. I mean, so Indian surgeons are in par, or in fact, sometimes better than the surgeons abroad. We get a lot of patients who come in from there who can't afford the surgeries there. They come in here to get the surgeries done.
तो पहले तो लोग यहाँ से जाते थे overseas.
We also go to Thailand and Turkey and all that, but they are our competitions. So we have to bring down or keep our rates in par with them. Only thing is here we suffer is that cosmetic surgery, we pay a GST tax, so that increases. And that puts us slightly, gives us setback.
Oh, I see. Okay, I didn't know that. And the rest of the surgeries don't have GST?
No, they don't have GST. So the thought process is wrong. Now, a lot of people, like suppose you have very heavy breasts, okay? And I do a breast reduction. Heavy breasts can cause cervical spondylosis. They're really uncomfortable. They have bra strap injuries. They've got fungal infections. And because the skin is always touching the skin, they're really large and they have low confidence, self-confidence, because they can't wear t-shirts. You know how people behave when they see ladies with extremely heavy breasts. And even when they look at themselves in the mirror, it's sagging. So their mental condition is not good. I have operated on a 20-year-old girl who was depressed because she had such big breasts. And everyone used to tease her, she's not good. She used to walk like this, trying to cover up her breasts. The day I have operated on her, within a month, she was off her pills. Why does that have to be cosmetic? That's not that doesn't have to be charged. That's an essential surgery.
But can it not be commented upon? I mean, if you just
I
going
mean, I
in,
think the
that will
association is
open a
trying to
whole-
tell the ministers, but I don't know whether they understand this point. Yes, I understand Botox and fillers and all that, but the world has become very competitive. I mean, if you see a smart person walking in,
It's a point.
whereas intelligent but not so great looking person walking in, you still always go towards the smart person, right? Now, if a person is aged and he wants to look nice for work, I mean, what's the harm? But
No, let me hold you there. Of course. Is there no way you can segregate? And there's nothing wrong with vanity. Hey, that's not what I'm saying. If somebody's going there for vanity and it's okay, and someone wants to get something done for correction, for relief, or how mental relief, peace, whatever,
yes.
you have to make a proper case for that, and maybe it would be heard because
So they should,
because it's a new
yeah.
industry by itself. I think everybody's still struggling
Still
with.
struggling. So there can be certain rules that can be set forward, like they can say breast reduction of above a certain kilogram you've excised, or if you've got an orthopedic reference stating that it is causing a problem, causing cervical spondylosis.
Yes, see, so then maybe
And then you don't give the GST, or insurance should cover it.
I see.
I think insurance has covered for one of my patients when I asked for a breast reduction. Even for a tummy tuck, it was like really large, they can't sit in the toilet.
Wow.
It sits in, the tummy goes, it's uncomfortable.
I never thought of that.
Yeah, but they don't think all these things. Okay, a girl with flat breasts and she puts implants.
And what are the kind of operatives do men opt for? I don't know much
Usually
about
it
that.
is man boob reduction because they're very embarrassed and they go into the swimming pool.
Is it
and-
like an Indian male body issue?
No, it's...
Or is it
it's-
generally everywhere? I'm just
it's-
asking because...
No, see, the majority of patients I operate are Indians, but I have operated on Africans, I've operated on Americans who have man boobs, gynecomastia is called. So it depends if the patient is obese, sometimes they get really large female-looking breasts, and then that has to be corrected because they can't go without their shirt. I mean, they feel, and some people don't care, but some people do care, and they are embarrassed. And they say, I don't even go into the swimming pool.
If it would be like a step by step, like 1, 2, 3, 4, what are the early signs of aging? How does, forget about what we think, how does the body actually age?
Well, it depends on person to person. Everyone doesn't
Generally.
age in the same. If a person doesn't exercise or an unhealthy lifestyle, a 30-year-old might look like a 50-year-old. So it's very difficult to quantify that way and explain that how the body ages. I mean, from person to person, you can't compare that. But yes, physical changes. When you see outside, you see the skin sagging, you see wrinkles everywhere. You see sometimes atrophy or the jowls forming in the face when you have the jowls. Why do you think I've got a beard? I'm hiding my jowls before I undergo facelift.
I can't do that, I'm so sorry. I wish I could. I follow you on your Insta. And you're a fitness freak. You
Yeah,
are
I have been
lifting
exercising.
buildings on your Insta reels. Why are you lifting buildings? Weights, I understand.
So I have been exercising continuously for the last 10 years or 15 years, I think. I have exercised from the age of 16.
Oh.
Yeah, so in
Okay.
between there were breaks when I was studying, I couldn't, but after that I have been exercising on a very regular, and I love exercising. I've got a couple of injuries. If I don't exercise, it starts hurting. So I exercise, and I like doing it, so I do it.
But that's a lot of weight you're lifting.
Yeah,
Is
I
that-
can lift,
is
so
it-
I lift.
Yeah.
If I feel I'm not able to, I just stop. I don't push myself. I'm not trying to become Mr. India or become a big bodybuilder or something like that. I just like to do it. Whatever I can push, I push. I don't set a limit like next week I'm going to go this much or next week I'm going to increase it. I don't do all that. Or I need to increase my bicep by 1 inch or 2 inch by the end of 3 months. No, I don't do all that.
You being in cosmetic surgery, but you are giving so much importance to actual fitness and weight management. Let me put it like that, for whatever body weight or whatever it works for. What are the actual emotional and wellness benefits of exercise? This is what we really hear. It jumps this up, jumps that down.
That's true.
What works? And from your mouth, please.
So the hormones which are secreted when you exercise acts as wonderful antidepressants and also gives you a lot of confidence. And burning fat out of the body is good. Fat in the body is bad. It causes insulin resistance.
It's not sweating fat, no, it's burning fat, right?
Yeah, it's
People
burning. When you sweat, you don't burn fat.
है ना?
So you can sit in a room of heat and then you can sweat.
हाँ.
That's why losing water. You're not burning fat.
है ना?
And you cannot say, you got last time, I'll do crunches and my stomach will go in. No, it doesn't work like that. So each person has got different body areas where the fat accumulate and then it will go away if you exercise. So mine might be by the tummy, your might be the thighs. So it's different for different people.
Why would I choose India today? for plastic surgeries?
Well, one, for all the patients from India, it's home. Second is surgeons out here, we are as capable, or I feel even better than our Western counterparts, because we do a lot of surgeries. So why would you want to go somewhere else and get it done when you have the expertise over here?
We get a lot of overseas clients coming in here
We
as
do
well?
get a lot of overseas clients, those who cannot afford the cosmetic surgery in their countries or who do not have the expertise. Like in Africa, they do not have the expertise there. So they come here to operate. If you have a patient from the UK or from America, this is not covered by the health schemes. So they want to get surgery done and it's frightfully expensive there. So then they come over here.
And what's the probably, let's say this is X
1:10 or 1:8 sometimes, 1:5.
So India does it at 1/10?
Yeah, 1/10 the rate.
1/10 the rate.
Yes.
And you're talking about top surgeons, I mean.
Top surgeons.
At 1/10 the rate overseas.
There are, of course, one or two surgeons who charge horrendous amounts.
Of course, you
but
always have
yes.
premiums in every.
No, it's just, I don't know, it's not a premium. He just charges so much, yeah.
Fair enough. Are the medical students also opting for this as a stream of?
So, medical students, if they want to become a cosmetic or a plastic, it's a long process. You need to first finish general surgery, then you need to do plastic surgery, which is again 3 years. Then in plastic surgery, if you have a teacher who does cosmetic surgery, you learn at the same time. After you're done, like I finished plastic surgery from Bombay Hospital, and then I trained in Bombay Hospital, and then I went to Brazil, where I trained in PUCRS University in Porto Alegre for cosmetic surgery. There they have, it's like a factory. They have 3 to 4 running operation theaters for cosmetic surgery on their OT day. And they have a huge list, about 8 patients a day for cosmetic surgery. And that's because it's how the culture is there.
What are the risks you are taking as a client, making your decision by the price only? I mean, there could be 100 kind of risks
Yes,
you're
so
taking.
I mean, come on, if you go to a surgeon who's least experienced, who's less experienced, you are not going to get a result as a surgeon who is well experienced, you know. I mean, we have done so many surgeries throughout our life, throughout our practice. So each outcome and how we judge a patient, because cosmetic surgery is, you have to have an artistic eye. You have to have a proportionate, you have to have the picture of the person is going to look after you have performed the surgery, you know, and what the patient wants and whether it is feasible to give the patient what she wants or he wants, and then do the surgery. And you should be able to deliver it.
And where does one play with the pricing? I mean, let's say I'm going there, hypothetically, and I want a tummy tuck. You get a price list, let's say, or you get like an invoice or something, or proposed invoice. Okay, there's hospital, there's doctor's fees, and there are 10 other things. Where do the numbers get played at, and what should one be wary of?
So usually in cosmetic surgery, we give a package. This is the package in this hospital, this is this much, this hospital. Rarely does it ever cross what is given. Unless there is a complication and we need to reoperate, then what I do is, suppose there is a immediate complication and I need to reoperate, I do not charge my fees, but they have to pay the hospital and the consumables and all those things. Sometimes post-surgery, some people don't heal, suppose they get infections, then the cost of course increases for their treatment.
If someone is deciding to do a tummy tuck or a liposuction or something more complicated with the face and all, how would you want them to look at the pricing so that they make the right decision? Of course, they've done the homework.
Now, it's very difficult to judge a person at how much he's going to pay.
Yes,
I've had a person coming in an S class and asking me, "Aapka mazduri ka fees kitna hai?"
Oh no, oh ouch.
I mean, yeah. And then trying to bargain and trying to ask me to adjust my consultation fees with the surgeon. And you have people who come in and don't even ask about the price, and they just say, "Doc, you know what, you're a little expensive, is there something you can do about it?" So then I try and help them out. There are some people who don't ask anything.
Fair enough.
Then some people come and bargain with you as if they're bargaining with a vegetable vendor. A guy from a top firm has done this with me, and I told him, "Listen, you might be the boss of the share market. Why don't you go to another surgeon? I don't want to operate you."
So, what are the top requests the ladies want to look like?
Top requests are
To look like somebody else?
they have stopped doing that, but
nice.
certain body parts they do. I mean, I've had a person who brought in a picture of an actress and said that, "Look, I want to look like her" and stuff. It was not possible. I couldn't.
But
I didn't
face.
have the expertise. Face. I didn't. I said, "Look, I don't have the expertise to do that. I can't do that."
Who did she want to look like?
She wanted to look like Rekha.
Like Rekha?
Yeah, when she was younger.
And the dudes, who do they want to look like?
Huh?
The dudes.
So they usually come and say they want, six-pack abs like Shah Rukh Khan or
Of course.
Hrithik Roshan. That I can do for certain patients.
But not
I have done it also and given them not exactly looking like Shah Rukh, but yeah, similar.
Have you ever fallen in love with one of your patients?
Oh, no, man. That's the end of my career.
So if I had to become somebody, who would I be easiest to turn
Who would
into?
you want to be?
I don't
And
know.
anyway, I told you that's not my expertise. So I don't do that.
Now you're losing me I've lost you as a doctor.
Yeah.
What would you tell the upcoming students to know about this profession as taking it full time? From your side, is of course it's a good profession.
When you're choose your surgeries right. Do not do the surgery for making money. See, you have to make a proper judgment. You'll burn your fingers if you do that. That's do a surgery only if it's indicated and you know you can do it. Do not do surgeries which are unnecessary.
Thank you very much for coming to the studios.
Most welcome. Thank you for having me.
We're going to
Cheers
be
for
calling
coffee.
you again,
Yeah.
and I'm hoping to look the same.
Wonderful. I'm sure you will.
Thank you.